A controversial new plan that opponents say would put the health coverage of Tennessee's poorest residents in jeopardy. Lawmakers are moving the state to a block grant system that would impact how TennCare gets funded. Chris Conti is covering this, and Chris, Tennessee is the first state in the country to try this kind of a plan.
Vicki, we would be the only ones right now who would implement this kind of health care system. Right now, the state gets Medicaid funding based on a ratio from the federal government. Lawmakers, though, want to just get one lump sum of about $8 billion from the federal government and disperse that as they so choose. What that might mean, though, is unclear. And today at a public hearing, folks were not happy. Crammed inside a meeting room in West Nashville, they waited patiently, clutching signs expressing their feelings. Then one by one, they let those feelings out.
These aren't just numbers. There are real people who are suffering.
It scares me to death because the state of Tennessee is not physically responsible to their poor.
This was the first of 3 hearings being held statewide, opening up the floor to public comments surrounding the state's controversial block grant program. Perhaps the biggest concern here, the proposal wouldn't expand coverage to the 300,000 people who can't get insurance right now.
There are people who suffer right now because the state of Tennessee doesn't do anything. It scares me to death because the state of Tennessee is only kowtowing to the rich. They don't really give a crap about the poor people in this state.
Currently, Tennessee gets about $7.5 billion each year from the federal government for TennCare. A block grant would be just an $8 billion lump sum. And unlike the current system, there's no restrictions on who lawmakers choose should and shouldn't get health coverage.
Shame on you, Tennessee state government. What in the world is the matter with you?
Today's meeting was filled with passionate pleas from the public to halt the proposal. All as the fate of the state's healthcare system remains uncertain. More than 30 patient advocate groups have written the federal government saying that they oppose this plan and that it would negatively impact the state's poorest residents. Worth noting that Governor Lee was not at today's hearing. His office said he had prior obligations. We're live in the newsroom this evening. Chris Conti, News Channel 5.